If you're heading into knee surgery and you want to do everything you can to have the best outcome possible, you can set yourself up for success with the right pre-surgery exercises. The reality is, knee injuries and degenerative joints happen to the best of us. And when the circumstances align, surgery might be the reset you need to have your next 5, 10, 20 years be as active and fulfilling as you can imagine. Now, surgery alone isn't going to get your life back. You need to do the work. And the first step is preparing for surgery. I'm going to show you the best exercises to do leading up to surgery. I'm Dr. Leslie DeRozier. I help athletes, outdoor enthusiasts, and everyday people stay active and competitive in their sports and adventures for as long as possible. Whether it's for prevention or rehabilitation, I help people have less pain and fewer limitations and become more durable and injury-proof for their lifestyle. Now, if you have the luxury of time to prepare for your surgery, rather than just sitting around and waiting for the big day, start your rehab before surgery so you can go into it with better mobility, strength, and flexibility. This will make it a lot easier for you to recover after surgery. As we go through these exercises, feel free to pause the video so you can focus on your own movements. The goal here is to improve mobility and strength without flaring up the knee and causing more pain and swelling. So this means you have to respect your pain and your limitations. If you have pain, grinding, or catching in your knee, try doing these exercises with as little of that as possible. So that means you might decrease the range of motion or reduce repetitions. So be mindful of that. So let's go through 10 exercises that you can do to prepare for surgery. If you want more detail and more exercises, you can get that in my online program, ACL Strong. In fact, there's a mobility and stretching routine, an early strengthening routine, and then a full 8-module progression of exercises to safely build strength and stability and durability for living an active lifestyle on the trails, on the snow, or on the court. So here we go. A nice way to get your knee moving is just to sit on a stationary bike and just go through the motion. Okay, so not so much focused on speed or resistance. So think of this more like for range of motion, circulation, lubricating the joint. Now, if you do have some stiffness and you don't have the range to get around yet, this is a great way to work it. So we call this rocking. So you just rock one direction, go to where it feels stiff, then go around backwards the other direction. Go to where you can. Go around forward again, and then go around backwards again. As you start getting close to getting all the way around, it'll probably be backwards first, and then it'll sort of free up. You might be able to go backwards a few times around, and then you're able to start going forward. So if you cycle for maybe 5, 10, 15, 20 minutes or so in your pre-surgery routine, it's a great strategy. All right, so a nice exercise to start with is called quad sets. So I took this towel roll, I'm just gonna roll it up and put it right underneath my knee so that I feel the resistance, something to press into. I'm gonna sit back in what we call a long sitting position. So I'm just sitting comfortably. I'm gonna tighten the quads, the muscle on the front of the thigh, and press my knee down into the towel roll. Hold for about 5 seconds and then relax. So quad set, press down, hold, and relax. That's it. Let's go to number 2. All right, so next we're gonna do heel slides. So I'm actually gonna put this down here so my foot has something to slide on, and I need a strap. So this is something that does not stretch. So a stretch out strap is a great option. I will put a link below this video for that. And I'm gonna slide down, use the strap to start in a quad set here. I'm gonna use the strap and pull my knee up and get a stretch in the knee. I'm gonna take it just to about where I start to feel the knee where it's stiff or tight. I don't want to pull through pain on this. Then I'm going to slide back down. I'm going to give it a quad set at the bottom, and then I'm going to pull it up again using my hands and the strap to help. Each time I can work it a little bit further. Squeeze the quads and then pull it up. Okay, and you gradually can work through that stiffness and get a little bit more range of motion. Again, being respectful of your pain during this exercise. The third exercise, I'm going to come back to lying down. I'm going to bend the other knee. I'm going to start with the quad set. So that's tightening the quads, locking the knee straight. I'm I'm going to engage my core so that I don't move through here, and then I'm just going to lift the leg up to about even with the other leg and then lower back down. Okay, bring it up and lower it back down slowly. So be careful of two things. One is going quickly, so you don't want to just let it fall back down. I want you to control it up and control it all the way back down. The second thing is what we call an extensor lag. So we do want to lock the knee straight through the whole motion. So what you'll find is if you're not really engaging the quads, you'll lift with a slight knee bend. Okay, or you'll get up and then you'll lock it and you'll come down and you'll let go too early. So really lock and engage fully initially and through the whole motion. And that's the straight leg raise. Let's go on to number 4. This is going to be bridges. So place both knees bent, feet side by side. All we're doing here is we're going to engage the glutes, press the feet down into the floor or table in this case, and lift the hips up, squeeze the glutes here, and then lower back down slowly. Now you don't want to lift with your chest. If you're lifting with your chest and not using your glutes, then we're kind of missing that point. We really want to engage the glutes, drive from there. You can even use your hands to kind of make sure you're turning those muscles on. Okay, we'll do glute bridges. All right, you can go through a couple sets of 10 of those. Then you can lie on your side. We're going to do similar to the straight leg raise forward. We're going to do side leg lift. So the top leg, I'm kind of switching legs for you just for the camera's sake, but we're going to lock the knee straight and we're going to raise the leg up to the side and back down. Now I don't want to go forward with it, so be aware of that for one. And two, sometimes your body will roll and you'll end up doing a straight leg raise because you've let your hips roll over. So keep your hips stacked, one on top of the other, and then lift up and slightly back. Just like that. All right, another exercise we can do is an isometric knee extension. So I've taken a band and I've actually tied it underneath the table. So you can do this on a chair. And then I'm seated at the edge of the table and I'm just going to bring the knee out just slightly and hold here. I'm going to hold for like 10, 20 seconds or so. Okay, so I'm engaging the quads. I'm not bringing the knee all the way up to straight. That can sometimes get a little bit hard on the kneecap or the patella. If there's any grinding or pain in the knee, then this is a nice one because you're not actually taking it through the range of motion. You're just engaging the muscle without aggravating the knee. So take it out about 60 or so degrees and hold there, engage the quads. Practice this sitting up nice and tall, and then bring it back down. This is another way to do an isometric exercise, but we make it closed chain so it's a little bit easier on the knee if you have any knee pain. So we're just going to sit in a chair and put a ball against the corner of the wall. And I'm going to just hold myself up straight, engage the core, press the knee into the wall. And so now I'm getting a nice co-contraction of the quads, the hamstrings, the glutes. Engage the core, hold for 10 seconds, and then relax. Now the mini squat or partial squat is a great exercise too. So just with your feet a comfortable width apart, just sit the hips back, tip the chest forward, but keeping the chest up. We're bending the knees, hips, and ankles and coming back up. So from the side, it looks like this, just a partial squat and back up. So this starts making your strengthening and your isometrics more functional. So work for how you will normally use those muscles in real life. So a sit to a stand. We can make that even a little bit more functional. Okay, so using a stool or a chair, scooch to the front edge of the chair and then slide your feet back so that your ankles are in a little bit of a knee bend, and then you're going to practice just leaning over your feet and driving up through the hips. And then same thing, you want to come down slowly until you touch down. If you have a chair with armrests, you can start. If you need to use your hands for support, that's okay. And then gradually work to build up your leg strength so that you don't need the arms. So we're going to lean over and stand up. So that's a sit to stand. And here are a couple stretches that you'll want to get familiar with too. So lying down on your back, place your hands behind your knee and just ever so gently straighten the leg up. And then you can relax it back down. So you'll get a nice stretch in the hamstring here with this hold. Holding for about 30 seconds or so, repeating 2 or 3 times. And you can take both feet in, set your feet down, and just let your knees fall out to the side, and you'll get a nice groin or adductor stretch. Same thing, hold for maybe, let gravity do its thing for 30 to 60 seconds. Repeat that 2 or 3 times. And another option for you is, if this is the leg we want to stretch, we're just going to hang it right off the table and let the stretch happen right here on the front of the hip. And in order to protect the lower back at the same time, bring your other knee in and hold that towards your chest. And you might feel the stretch right here. Now, if that's too aggressive, or if you feel that pulling in your lower back and you're making sure to lock this leg up, then you can do this one standing as a hip flexor stretch as well. There you go, 10 or so exercises to help you get ready for surgery. If you want more, you can check out ACL Strong and get more exercises, coaching, and support. We can help you get back to your sport and prevent injuries so you can be as active or competitive as you want for as long as you want. Thanks and have a great day.